14 at the other.
Okay, quiet.
Do you think people are getting them at the
Actually,
pharmacies?
the pharmacies are out of a lot of them too now.
Really?
But yeah, Christine called around earlier because high doses are out everywhere now.
I know.
So we have 5. Yeah, no, I was talking to someone in a couple of different communities, actually, I keep in touch with. And some people aren't doing flu clinics at all.
Mm-hmm.
Some people are all completely done with their flu clinics and did under 200 or around 200.
Mm-hmm.
And the majority of people I'm talking to are like, oh, yeah, we had a big flu clinic. And I'm like, oh, great, how many? And they're like, oh, it was like 30. And I'm like, and I'm like, they're like, Laura, we know your silence. What does that mean? I'm like, I did 300. They're like, wow.
Yep.
Yeah. Yeah.
And I know too, there's some other towns that are just, so I was trying to do some work with Andover and North Andover and
Yep, they're just starting. Because they asked me how I did it so big.
Yeah, they're just starting. So,
but that's my big one because I have, hi Kev, that's my big one because I have the state come to it and everything. So I try to really do that one up.
Yep.
So that's the most, Elise from them. I'm the helper.
Okay. Hi, Kevin.
How are we doing tonight?
We are living the dream. So everybody's here. I'm going to call the meeting to order. Hi, everybody.
Okay.
So first item on the agenda is public comment, but I see no one present at this time. Second item is review of minutes. Jean, can I ask you to, I'll start us, right? So, hey, thank you everyone for reviewing the minutes over this time. Thank you, Jean, for getting that all together.
Oh, yeah.
I found that process worked well for me. I just kind of parked in front of my computer and reviewed. After taking, got on a rhythm. So, hi, welcome to the Board of Health meeting. Christine, were you joining us because you wanted to, you had a question for us? You're on mute. No, Christine, I don't know if you can hear me. If you can hear me, you're on mute. I don't know if you had a question. If you do, you're welcome to unmute yourself and.
Oh.
Hi.
Hi, thank you.
Did you have a question?
No, I attended a meeting last month and I was just hoping to follow up. I'm doing a school project on seniors in towns. I was hoping to learn a little more still. So thank you.
Okay, great. Welcome.
Thank you.
Thank you.
Indeed, welcome.
So, right. So I don't know if anybody else had any questions or thoughts they wanted to share about that review before we go into them.
I would agree with you, Carrie, that it was great just kind of being able to sit down. It took, a couple hours, but but being able to do it all in one place and all at one time, and it was helpful. And then as Kevin had suggested last time, seeing going over just the track changes made it quicker the second time around.
Mm-hmm.
I don't know exactly how we want to process this. Whether we just go to, if anybody has any specific questions, or we just, and if not, then we approve them en masse, or go one by one. I don't know what folks want to do.
So I think we have to vote to approve. We have to name which ones we're approving. I don't know if we agree. Right. Jean, can you walk me through where we are with this final collection? I don't have my list of which factors.
So the minutes that we provided, and the board, thank you all for being so quick about it. That worked out so well. So we provided 19 sets of minutes. The earliest one was March 16th.
Yep.
And then the most current one was September 21st. And these are minutes that we identified, and I have a spreadsheet, but I won't bore you with all of that. But we identified minutes that could be converted. Laura had sent these out in email form, so you probably saw them at least once. But what we thought would speed it up is doing it this way with the track changes. So I just converted all the documents. They were in a template that the town uses for when we post minutes. So I just cut and pasted them all and made them into Word documents. And then I cut and pasted the heading, which saved a little bit of time on the attendance and so forth. So there's 19 sets. It's track changes. I then got all the feedback from the board and made one master track changes version that I emailed out. So that's where we are at. I will tell you that there are another, let's see, 1, 2, 3, 4, 5, 6, 7, 8, 9, another 9 sets that Jackie back in the office is working on.
Wow.
So that combined with this 19 should bring us pretty much to being caught up.
Yay.
Okay.
That is fabulous.
Can I make a suggestion
Please,
on how we should proceed?
please.
I think that the simplest thing would be just if anybody has any comments or questions about someone else's revision that they made from the red line changes, we could probably just go through them one by one, or just have people point out the specific ones, and then you can, like Carrie said, you can just name them all at the end if all the questions have been answered. Anyone that's amended, we can just pull out and put off to the side, and the rest we can just say from this date, this, and go right and just name all the dates and do it in one big mass thing, and then put the ones that are amended off to the side and saying these ones as amended here tonight, if need be. Otherwise, if there's no more changes that anyone needs to make to anything tonight to the final version we saw, we can just approve them all in one big mass motion.
Sounds good to me.
Sounds good.
Okay. Does anyone have any questions then about the ones that we received? The markups?
I do not.
I don't.
Okay. Sorry, I'm away from my camera. Polly, did you have questions?
No,
Okay.
none.
And Jerry, you just got to have kind of a magical mystery tour and catch up on everything
I
that's
did. I got to
happening.
pop in
It's
and
like-
read them. Yeah,
It's like a history lesson.
it is. It's
Yeah.
a very busy history lesson.
Yes. All right. Well, so if there are no questions or concerns about any of the changes to them, then I think we can just go to what Kevin said. So we've got the list. Sorry, and I'm sorry, I'm having trouble finding the email. I put it in a safe place. So I'm struggling for the list.
Would it be helpful if I pulled up the spreadsheet and then that way you can just go off of that?
Yes.
There you go. That'd be great.
Yeah, that would be great.
Okay. I think I have that in a very easy to find place. Okay, give me 1 second.
Nearly 2 years worth of minutes in one fell swoop.
Amazing. I just can't get over how much Kevin, you and Emmy and Eleanor did, along with staff. It was a lot.
And Marie.
It was a lot.
Anne-Marie,
They did
yes. and
Yeah.
Anne-Marie, yeah.
Yep, it was a lot. Everyone should be commended very much so for that effort.
Absolutely.
And
Absolutely.
it's always interesting when you read back this and as you're reading through it, you're like, oh, that's right. I remember that. And I said this early on when this started. I said, there's going to be a lot of things that we're going to learn from this. The biggest thing we're going to learn from this is just how wrong we were on some things and how right we were on other things out of pure luck. And it's
Right.
funny when you read back through this, you're like, yeah, that didn't make sense now.
Right.
Well, that was
Right.
great. And we didn't even mean to do it. That's my favorite one when you read it.
Yep. Yeah, no, it's true. I mean, you do the best that you can at the time with the information that you have, and
Which
some
was zero.
Exactly. I don't know if you. They talk about it's the flying the airplane while building it. That's what everybody's doing. Yeah.
Yep.
A lot of fun. Great. Look at that list. Okay.
So is this straight through, Gene, or in other words, I know you said starting on 316, but is it just a highlight or just a highlight?
So it's going to be this column here, the minutes drafted. The
Got
being drafted is where Jackie's doing some work. So it's this
Okay.
column, the middle column.
Got
The
it.
middle column ones, the ones.
Yep.
Okay.
Okay.
So if, Gene, if you can scroll at the appropriate time, I'd like to make a motion to approve the minutes for March 16th. All of these are 2020, March 16th, March 25th. It's getting smaller.
Oh yeah. Okay.
My glasses.
I was helping.
Oh, no.
Now you're good now. If you scroll now to the
Yes, I'm good now.
down to the
April
next one, the
10th,
third one, Gene.
April 13th,
I'm
April
sorry, what
20th.
did you say April 10th? I'm sorry.
I think I said the 10th.
Okay, sorry,
Yep.
I didn't hear it.
Yep. And April 20th, April 24th, May 4th, May 15th, June 4th, June 22nd, July 6th, July 16th, July 27th, August 3rd, August 13th, August 17th, August 20th, September 3rd, and September 21st.
Awesome.
So
Second.
that's a motion.
Second. Roll call.
Excuse me, this is Allison.
Oh, hi.
Hi, I think you meant to say March 16th executive session to be on your record. That's what it said because there's a difference between executive but I think.
Oh, good
Gene,
catch,
you're-
Allison.
Wow.
Okay.
Is that an executive session?
Executive.
Is it?
Yes,
Can you
it
roll
was.
back?
Yes.
We should, well,
Let me amend my motion.
let's remove that one for right now. Yeah.
Yeah, to
Thank you,
approve
Allison.
March 16th as an executive session.
Great catch, Allison.
Yes, really nice. Second. Roll call. Carrie, yes.
Paula,
Rick-
yes.
Rick, yes.
Okay. Motion
Um,
carries.
and so the reason why that was a great catch is because we release executive session minutes when we feel that they're no longer relevant and need to be, it's not that they're no longer relevant, excuse me, when we no longer need to keep them from the public.
Yep.
So you can still approve it tonight. You just want to look through and make sure that that was the case, that, there's nothing relevant on there that the public shouldn't be looking at. And most likely there isn't.
Okay.
Jean, will you be giving those to Laura, Jim?
My plan was to give them back to you.
Okay.
Isn't that
If you,
normal?
can they go by email? Because I'll just forward the email to Laura, Jim.
They're on the server, if that's helpful. Do you want me to just point you to the link so it's easy?
Sure. If you want to just send me the link, I'll send it to her.
No problem.
All right.
I'm just
So-
scanning this right now.
Thank you, Kevin.
I don't know if anybody else, I honestly don't see anything that would warrant still
I'm-
keeping these.
Yeah,
the
I'm
public.
trying to scan it as well.
Can those
It's
all
not,
go in
it's
one
not a
link?
normal, sorry, go ahead, Laura.
No, I was just wondering if they can all go in one link or if it'll be too big for the server to be sending.
So you can, and excuse me, it's Allison again. You just approve the minutes, which is separate from releasing the minutes. So now that they're approved, but releasing them to the public is a different vote.
Really?
We would have to take an additional vote for an executive session set of minutes to say that we want to release them. Is that what you're saying?
Yes, because when you do your meeting minutes, you want to go through the whole process of reading them and approving them.
Yep.
When, they're fresh in your mind.
Yep.
But you may not release something regarding a lawsuit for 4 years because the
Right.
lawsuit's still relevant.
Mhm.
Right.
So tonight you just approved it, but then you would vote to release it. You can do it tonight, but I'm saying it's 2 votes.
Got it. Thank you.
Thank you.
You can do it all in one motion though, right, Allison? Vote to approve and release?
Absolutely. Absolutely.
Okay.
Yeah, so the reason this was called an executive session at the time, obviously the world was crumbling around us, and we weren't sure what was going to be discussed. So
Yep.
there's nothing in here that is relevant today that the public doesn't need to know about, in my opinion.
Yeah, I agree. I don't
Didn't see anything.
I don't see anything sensitive. Okay, you don't either, Paula. Okay.
Nope.
No,
No.
it looks fine.
Okay. Okay. So then,
Motion to release?
second.
Yeah.
Approve and release.
Approve and release. Motion to approve and release, second.
Second. Roll call. Carrie, yes.
Paula, yes.
Rick, yes.
All right. That was a big chunk of work. Congratulations to us all.
Yeah.
Take a second and say, yeah. So we do have another set. And if it sounds like it worked well for folks. So from our end, that process to repeat that process for the remaining minutes would be fine if that works for the staff. And Jean, you thought that would be okay?
Sure.
Okay. And is this something, so it's not going to happen in time for our meeting on the 15th, but it should be able to happen in time for our meeting on the 4th, on November 4th?
I can't imagine it would be that, before I say yes, I want to just double check, but we'll try for that, definitely.
Okay.
It's November 5th, right? Is our next,
Is it?
well,
Well, our next one's the 15th, right? We have one next Thursday as well?
15th.
Yes.
I don't have an agenda yet though.
right.
Yeah.
Unless I have one, I just want to make sure it's finalized before I send it out.
Yes,
Okay.
thanks. Yep.
Okay, and just to make sure, you're going to send me the link and I'm going to send it to Laura Gem, right, Jean?
Yes.
Okay.
So our next batch of minutes will be November 5th. So we get the same kind of process to work in the week before, once Jean says that's okay. And then we can approve those. And then at that point, we will be caught up and we would be able to be on a regular cycle of reviewing and approving minutes at the subsequent meeting. So that's nice, I think, for everyone.
I'll make Laura Gem very happy.
So we're almost there. Thank you again. All right. So COVID-19 updates. Reading is still green.
Excuse me for a second.
Yes.
For some reason, I got bumped off of the Zoom twice while you were talking about the minutes, so I didn't hear what was happening with the rest of the minutes.
I'm sorry. I thought I saw you there. I'm sorry. Thank you for telling
I was in
me. Okay, so we'll use the same process. We
No, but
have
the rest of the minutes, you didn't approve the rest of the minutes, right?
we don't we haven't no, we were just talking about when we'll be able to do the rest.
Oh, and then do them all together, all these 19 and the other 9?
No, we did a roll call for approve and release for the 19.
Right.
And you
But
and
I
you
didn't-
said, Paula, yes.
What?
You did.
I thought I had gotten cut out because I didn't hear
No,
it.
we heard you.
We heard you.
We heard you.
Okay, then that's fine by me.
Okay. Whoa.
It works.
Okay. So then you heard the part about that we'll use the same process to do the next set, the remaining sets?
Yeah.
Okay.
Yeah.
All right.
Thank you. Sorry.
No, you're fine. Thank you. Okay. COVID-19. Reading's still green. But if you look at the map, we're surrounded by a sea of yellow. And Linfield keeps kind of toggling back and forth. And Woburn is red. So, yeah, and I mean, the positive testing results now are around 420, 450 every day. That's been a pretty big, about 100 more since about a month ago. And, you know, we talked about how things will look different from month to month to month. So, I know from looking at the dashboard reports that the highest number of cases right now is coming from folks who are in the 20 to 29 age group. So not associated with school openings. I know most places haven't really pulled a lot of students together, but that's not driving it. Or it's not a driver. And colleges appear to be running pretty well. There was a lot of concern about colleges coming back in, and would that be safe? And the numbers are low. The percentages, the percent positives are quite low, and they're being safe. So
That's
far,
great.
it's great. It's really great. So and then comes but we're gathering, it's more people are going to start coming together, right? With the guidance has said now you can have 10 people at the bar, and you know, small changes, but changes are happening, and it's getting cooler, and people are going to be inside more, and you know, we worry that that's the time where the second wave is coming. Nobody said yet the second wave is coming, but everybody's, at least nobody I've heard. I don't know if anybody else has heard that from another source, but
no, but I haven't heard that, but I have heard that the hospitals are preparing for it.
Yep.
All the Boston hospitals are preparing for a second surge.
Yep.
Okay.
Yeah. So, I mean, face coverings. I did a little, I was a little fussy, I guess, at command and then at the select board. Please wear your face coverings, please, because it works. It works. And I just noticed before we started the meeting, the Patriots game is postponed again because somebody else tested positive. And, you know, it's interesting to compare football to basketball, because football, you know, basketball's model of the bubble has worked well.
As did hockey.
And unfortunately, football is not having such success. Oh, and thank you for raising hockey, Kevin, because that was an interesting point from the call last week. When they were looking at what were sports. Did I talk about this last week? Hockey
think so.
was, when they were reviewing cases at the state level, kind of, and looking at the contact tracing results, one of the commonalities among cases was youth and amateur hockey, which is, consistent with, we've had a few, complaints and questions about at our own facility, and there are other places that are experiencing the same thing, clearly. So we still come back to the same place, right, of face coverings, hand washing, social distance,
And proper use of the face coverings. I still see a lot of people with the mask down here.
Yep.
It drives me crazy.
I agree. What do people think about, we had talked about maybe having a statement. I was thinking about whether we have a statement. Risk communications, your principles are, you want to use like a trusted source, and certainly one of our public health nurses is a trusted source. We also have clinicians on our board of health. Do people feel like it would be appropriate to make a statement about what folks ought to be doing?
So I had asked Jane Wellman when I was attending the board meeting for you, the command, the command meeting. And she said she was going to do it, but it doesn't look like she did. But there were a lot of things going on.
Yeah.
So she may have just forgotten. I can be in touch with her again, or
Great.
we can come out with, I'm happy to craft a statement about what the Board of Health is recommending to the public. I don't know which way you would rather go.
I
What's
think
the will
a
of the
statement
board?
from us would be a good idea. However, we come up with the language for it.
Yep.
Okay, I'll draft something and send it to Laura, and she can distribute.
Okay.
Okay.
And
Or would we, or if you drafted something, would that be like a press release or something that would be posted on the website? How would it get communicated? I was thinking a
I was
press
thinking it would
release.
go on
yes,
the website.
that's what I was thinking too, Rick, a press release that would be
Press
suitable
release?
for posting, and sharing by email with community partners, as appropriate. Yeah.
So I would still send this to Laura for distribution, or who would I
Yeah.
send it to?
I mean, maybe you want to draft.
First to everybody. Yeah.
And Jane, I would want to loop Jane. Well, is Jane's the PIO, right, Rick? Is that right?
Jane is the,
Sorry, the I don't even
no,
remember.
Jane,
Public information officer.
Thank you.
That's not really her title, but
It's not?
no,
Who is the PIO?
we don't have one.
There's not one in the ICS structure either?
There
Oh,
is
wow.
the ICS structure. Yeah.
Okay.
The ICS structure, it's Matt Cornelis.
Okay. So that would be so we would need to share our statement with command because it's COVID.
Okay.
And get their feedback. And that works well because, we share it with command. And then get it issued. And I'll say, that would be great. Thank you, Paula. The Board of Health strongly recommends, please be safe. And I'm looking, green, yellow. Oh, there was a question about COVID. There was a question at command. I'll get to command. There's a question in command about testing, whether you could test out of quarantine, and that's where I really did kind of get stern, because there are test-based strategies for first responders and healthcare workers, but you can't test out of quarantine, right? You can't. You have to be quarantined for 14 days. And there are some misconceptions. I think some of it has to do with the travel policy, because travelers can test out, right? Someone who travels to the Massachusetts from a hotspot from another state that has a higher case rate, they can have a test when they arrive, and once they get negative results, they're allowed to clear, but they're not quarantined because they haven't been exposed. So theirs is like a possibility of exposure that they're testing out of. If you've been exposed to COVID, you have to quarantine. And it's yeah.
So when you say you've been exposed, though, I was gonna say, when you say, Carrie, that you've been exposed, is that you've been exposed to somebody who tested positive, but you yourself have not?
Correct. You've been exposed to a positive case. Yes.
But
So
can you the question I guess I would have is, can you test out if you've tested positive? And then, you obviously that's going to be somewhere generally in around the 4 or 5 day range of exposure. You test positive, then over the next, let's say, 3 days, you're not feeling well, and then you don't have symptoms for the next 3 days, and you test again and you come back negative.
Yep.
Right.
So you can test out of isolation if you're a healthcare worker, a first responder, or an essential worker.
But it has to be twice, though, right?
Correct.
Not just once?
Twice, 24 hours apart, and you have to have no fever, and your respiratory symptoms have to have improved. It's not an absence of respiratory symptoms, but they have to have improved.
Okay.
So yes, it's possible to test out of isolation, but you can't test out of quarantine because the incubation period is 14 days. It doesn't.
and I even heard in one case it went to 18.
Yeah. So so travel policy was one, and then I guess people were saying, if they see the football players are doing things and things are different, you can't test out of quarantine. Does anybody have, Rick, you have any thoughts on this?
No, I think those are the guidelines.
Yeah.
Those are the guidelines.
Did you have a question, Paula?
I don't think the public understands that clearly, and I'm not sure how to educate them. I know for a fact that in Woburn, where it's red, my son-in-law was exposed to 2 people who were positive. They had him get a test. It was negative. They told him to come back to work.
They can't. Oh, that's wrong. They can't.
Right.
And employers cannot require test results, nor can they require a note from a doctor. If you're out, I mean, yeah.
Right.
Maybe that's why Woburn's red. I don't know.
Maybe
things like that happen. That they're not.
Right.
Yeah.
So that would
So
be
I'm wondering just how much.
Sorry.
The businesses. I'm wondering how if the business need to have further education.
Yes.
Around that.
Yeah.
Well, this is one-on-one contact with the town nurses that are doing contact tracing, correct?
Yeah, he should have been contacted by the school nurses, and they can give clear orders.
He doesn't live in.
Right.
He doesn't live in Reading. He doesn't live in.
But
I was just giving it as an example.
Right, but they have nurses in the community where he lives, right?
Yep. Yep.
And Laura, correct me if I'm wrong, I'm pretty sure all along our nurses have been not only making points of contact, but continuing following up throughout that process in order to get those folks off the active list, correct?
Correct.
Yep.
Okay. So I think we have it probably very well covered here in Reading. I just want to make sure that's on the record.
Yes. Yes. I mean, I think people do ask questions. Our staff, yes, are very clear on what the standard is, but there are still, civilians and non-civilians are asking questions about it. Paula, in the specific example that you raised, that's an issue to be addressed with the Department of Labor Standards.
Okay.
Yeah, and they have there's a email address. Laura, do you happen to have it from DPH calls? There's an email address for the Department of Labor, to contact Department of Labor Standards with a question or comment.
I would contact the actual town first. If I, my opinion would be I would contact the nurse in Woburn. Jean, I know you know her. What's her name? I forget.
Mhm.
It was
I think.
Jean. Are you still there? Oh, it was the lady you knew that could help Christine at the beginning.
Mhm.
I would contact the nurse directly and tell her what the problem was, and if you get nowhere, then of course you can always go to the Department of Labor Standards. But I would.
Okay.
You know, it might be based on this conversation, it might be a good idea, Paula, when you do a draft of the press release and work it through Jane and then the command, that there be a paragraph or a couple sentences that say, you know, that there's a lot of confusion about when in contact, whether you should be quarantined and how you should be tested. And if you have questions, you know, call Christine Harris at blah, 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 blah. Phone number. You know, that would, I mean, that's, I know that the main issue we want to get across is the, you know, social distancing, the hand washing, the mask and so forth. But this whole issue about if you've been in contact, it's too complicated to put down in a press release, but you could just give a reference to call.
Okay.
Yep.
Okay.
Excellent suggestion, Rick. I agree.
Thank you. That's a good point.
Yep.
Good point.
And just so you know, Kevin, when was it? Friday or Saturday night that woman, that there was a question that they called on?
I feel like that was Sunday night, right?
Was it Sunday night? So people do
Sunday night.
reach out and call, and it was, I talked to her Sunday night so that she was ready to go for her business on Monday morning. So some people do already reach out and call, but obviously it never hurts to let them know that, you know, we're here to help them and answer any questions they might have.
Absolutely.
But they know how to reach us even on Sunday night.
Oh boy.
Maybe it was Monday night.
Yeah.
No, it was definitely over the weekend.
Yeah, I thought it was.
Thank you for that. Thank you, Laura.
Okay.
Okay. I'm just looking at my list just from command. And from command, we talked about the election. Laura Jen was there talking about election day setup. There have been some slight modifications to the setup based on experience from the September 1st election. And Laura was going to make the modifications and send it back for review. Small, you know, a little bit about flow of people, trying to address the confusion that was happening because we were having entrances at opposite ends of the field house. They've gone back to the idea of just using the main entrance of the field house and adjusted the flow internally to accommodate that. So those plans are well underway and they're ready. So that'll come back. Let's see, there was a little bit of discussion about the flu clinic, the September 29th flu clinic and the success that it was. And I know Deputy Chief Jackson was going to lead a debrief with the staff to talk about kind of how this happened, what the flows, what the pluses and minuses were. And that's with an eye towards if there needed to be other vaccination clinics at that site. You know, I mean, he had observations. Everybody had observations, I think. Laura, was that something that you participated in? I think I said it was going to be Tuesday.
Yes, it was me, Paul, and Christine.
And how'd it go?
Great.
Okay, good. So I look forward to seeing those results. I think that'll be interesting to hear how that went. We talked about this. Going to be there was a request for a march to occur on October 24th for a group of students who attend the high school, I guess, but it's not a high school group. It's not a high school club. So there was some discussion about the safety of that, and I just got a message today that the town manager was able to meet with the person who's organizing it and discuss the need for safety measures and face coverings and the like. So,
Was this
say again?
Paul, I'm sorry, Carrie, was this a public service request because, what's it called? A civic function permit, because I did not receive it, so I know I have not reviewed it or given it to Paula. Did you see it, Paula?
No.
I saw one about a march for Breonna Taylor. Is that what we're talking about?
I haven't seen anything except for the Black Lives Matter march as far as civic function permits.
So this is there was an initial request for a march in September that I know I saw, and then they postponed it. And the town manager was trying to be in touch with the organizers. He wanted to be in touch with them himself. So he had been working this issue. And he was just able to meet, and I'm just looking to see.
I know there was a few that were discussed at command this week, but I have not received them for review.
Right. No. So they completed the form. He had it. He wanted to talk with them because they had some public safety concerns. And they needed more information. So they got that. And I'm just looking for my email. Because it just came in. So coming March. Okay, so at this point, it is just on email. I think that these are our younger students who are new to the permit process, and he's wanting to be accommodating and working with them and trying to help understand. This was, do you remember, Laura? This was the one that was proposing. We couldn't tell if it was a group marching from the high school to town hall and then one from town hall back, and it was, are they going to cross? What, yeah, you remember that, Paula?
I do.
Yeah.
And that was my concern, that at some
Yes.
point they were going to be in close proximity
Exactly.
and that it wasn't going to work.
Okay. So the town manager took this on because there were so many questions and wanted to be in touch with the organizers and understand what was happening. He has accomplished that. And it will push through now, I think, the civic function piece. It is scheduled for October 24th with a rain date of October 25th.
Okay.
And that's that. Okay. Oh boy. I know, Allison, that you are, you have joined us. Would people be amenable to going out of order and having Allison do the contract with us so that then she can leave?
Sure.
Great.
Sure.
Absolutely.
Thank you.
Did folks have a chance to review the document? Okay.
Yep.
I reviewed it. I have it, and I did track changes. I sent it back to Jean and Allison. Is it easier if I share mine or yeah, okay. Bear with me. So many things in my tray. Everybody see that?
Yep.
Yes, good. Okay. So I will scroll down slowly, very slowly. I didn't have any comments on that page. I marked up the scope a little bit. There was hire a consultant to review the status. So these are my changes in red, and status of public health delivery, including but not limited to We'll also include interviews with, I wanted to make sure and include this piece of interviews with staff and Board of Health members. We had talked about that. Is that agreeable still to folks? Yes?
Yes.
Okay.
Do you think it would be helpful to put a quantity of, so again, just to try and make this a document that people can put a good number to?
Yep. So,
I mean, you know, just to say, you know, it's estimated that it would be X number of interviews, so that when they go to do their budget, they'll factor that in.
yep. Staff and Board of Health members with, so if I do approximate with approximately,
Would you want the consultant to talk to all members of the Board of Health? So that's 3.
I would think,
2 associates. So that would be 5. And then, I assume the town manager, I think you said.
yep,
Myself.
yep.
And then the health staff. So that would be, if you want to call it 5 and 5?
Okay.
Approximately 10.
Yep. Approximately. Staff and Board of Health members.
Yep.
There we go. Okay. Typo. And then this looks way messier. I'm gonna shift to sorry. I can't shift. All I did here was just added in this language. Standards that would be applied and referenced in the final report are the things that we talked about, the blueprint for excellence, and I corrected the link to have it be the state. Oh, where'd it go? I lost it. To have it be the state, I'll add it back in. Have it be the state, the Mass Special Commission report, and then the 10 essential services. I just add a little descriptive language on it, and that's the CDC source. And then I put in, I know it references the FAB standards later, but I just included it as standards that would be applied and referenced. I just wanted to have them listed there as well, so it's not a surprise. And then I took out this priorities piece. I wanted to, because to me, that was the piece that goes with the community health assessment that we're talking about, the next step. Is that how others remembered it?
Yes, I saw
It
that.
makes sense.
Yeah,
Yep.
I thought the same thing.
Okay, good. Did anybody have any, I'm sorry, I didn't ask. I'm just going through my changes and I didn't ask. Did anybody have other changes to the sections that I've reviewed already?
No.
Okay.
Nope.
So then where I got worried was here. So I marked these up with these standards. Because I was concerned that these standards might be higher than what the field bears. I don't know. And I didn't know what the impact would be is if we had somebody, if the people who bid all were unacceptable because they'd only done 5. So I wanted to discuss that.
I actually agree that I thought the standards were kind of high.
Yeah.
So,
But I don't know, who's out there for.
Right.
so just so you know, this is Allison. I chose those randomly, and I don't know your market.
Yeah.
So if you know your market, or someone could do this with less experience, by all means, you want to get people to respond.
Right.
So that you can totally, but it's usually just a general feeling, unless you're hiring, a superintendent of schools, you want to make
Right.
sure that but you follow me. So you can change them to whatever you're comfortable with, that you think you would get a good proposal from.
Okay.
Are you suggesting adding in a lower number or removing a number at all?
I was trying to figure out how to arrive at a number, Kevin. So thank you for asking that. I've reached the edge of my experience here. I don't know how many reports the folks that are on this list have done. I know they've done it. I know that they are the people who, when you ask folks in public health, I'm trying to shift my thing so I can see everybody. When you ask people, they say, "Oh, these would be the names." But I don't know that much about their business. I know the names, I know who they are. So I was stuck, frankly.
So can I ask another question?
Yeah.
Is there a set number of vendors or that you're only going to reach out to get this from, that you would feel confident if any one of them responded, you would be okay with them? If that's the case, you don't necessarily need all this criteria. If you're only going to send it to who you would be happy if they gave you fair pricing, etc. from, then you don't need as much in the document.
Okay.
Because you're not publicly posting this anywhere because of your dollar value.
Correct.
Right, Allison. These are stringent, strictly because this is a form used to go out for to bid out to the public, and if they meet that criteria and they're the best and cheapest, you have to take them, right? But we're not under that guideline. We can pick and choose whoever we want.
Yeah, so we're in sound business practices. This is, I think, just as more or less a backup to any decision that gets made. Having the criteria, I think, is always helpful should anybody question and say, well, why did this one get picked over that one? Why did you pick consultant A versus consultant B? Even though we're not required to go through this kind of an exercise, in my opinion, it's always helpful to have the criteria to back up a decision and say, this is how we arrived at it. The other thing that can happen, and it's probably unlikely, but it can happen, that the 6 or so consultants that this gets forwarded to, one of them could say, you know what, I think my plate is too full. I'm going to forward this to my colleague.
Right.
And see if they might be interested.
Mm-hmm.
And that colleague could look a little bit different than the list that is crafted by the board. So even though this probably is a little overkill, it might not be a bad idea to just make it more palatable to what you're looking for, but still have this as part of the process, even though it's not required.
Yeah, I mean, I like the idea of criteria, certainly, and assessing the methodology, so 5, and 6, I mean, those are nice, solid qualitative ones. I think it's the quantitative aspect that is, I was struggling with it. It's a little strict. And again, I just don't know. So, I mean,
But you could even simplify it and say, has at least one, has done this at least one other time. And then if you've done more than one, great. If you've done more than 2, even better. I mean, right, Allison? You could make it anything you want.
Absolutely. And Jean makes great points. I mean, it is good that you can go back and review it 6 months from now and understand why you chose who you chose, or if you're questioned about it. Yeah. But no, you can make these, instead of 10 years of, like the one that says, instead of 10 years of experience, you want 3 years. You don't have to be that restrictive.
Right. Right. So, right. Yeah. Okay. So let's knock. So experience has completed 15 or more. I mean, that feels very high. So I don't know.
Like 5?
Okay.
Do you think 5 would be
People like
reasonable?
5?
Seems like a good number.
Yeah, you could go 5, 3, 2, 0, unacceptable would be never done it.
Yeah.
Yep. And I X'd out the 36 months because I didn't know. Do people care about the 36 months? I'm okay with it, I guess, if we've lowered the number of things, and I like the idea that it would be kind of recency.
Oh,
Yeah.
highly advantageous to me would be 8 months, right?
You prefer it to be more, right, to be more recent.
Yeah.
Right.
So you
Okay.
could do it that way. You could just get greater and greater with the number of months.
Correct.
36 could be, I don't think anything's unacceptable, but
Right.
but if you wanted to make it go that way, you could do 36 as the unacceptable and just grow the number of months as it goes
Right.
down.
Okay. So.
And then just make sure as you're doing that, there's like on that first, on highly advantageous, you have the RE and reports taken out. So just
You're very good.
unedit that.
Got it. I just added it in. It's, yeah. Okay. Thank you, Kevin. So intervals of, we do 8 intervals of 8.
8, 5, 3, none.
Well, no, we go the other way. So you
Yeah.
could go, you could go like,
Oh, right.
yeah,
8,
Sorry.
16, 24, 36.
12.
yeah, something like that, Rick. Yep.
Okay. 8, 12, 24, 36. Is that what I
Yeah.
heard?
Sounds good.
Sounds good.
We're gonna knock this out, people. I promise.
One more edit on not advantageous there. The number 5 in parentheses.
Yeah.
Cross that out, right?
Yes. Thank you.
All right.
Eagle eye. All those closings, right?
Contracts matter.
That's right. Yep. I'll go back and clean that. Okay. And then experience with government clients. 10,
I think 5 would be sufficient.
so
Yeah.
highly advantageous is 5. Others agree?
Yes.
Yeah, you can do the same thing that you did in the other structure.
Yep.
5, 3, 2, 0, right?
Yeah.
And the same thing here. Do we want to delete part where it says health departments and at least 5 years of experience with governmental clients? What do you want to leave? Or you just want to go down and make that number
Thank you.
compensatory to the first number?
Yes, it should conform, I think. Is
Yep.
that what you're suggesting?
Yes.
Thank you. Hidden. Oh, it's not there. Oh, I see. Okay.
Or do you,
All right, so-
or do you want to just take that all out entirely?
Yeah.
Just end it
Yeah.
at health departments.
Departments, I agree. Yep.
Cool. Oh, well, that was too far. Try that again. There. go. Got it. Sorry, this is like watching paint dry, but thank you for your patience. Okay, project size. Yeah, that
I had one question here
Okay.
for Allison. The way I read this, and correct me if I'm wrong, is governmental clients which have 1,000 or more employees. Are we talking about our health departments?
Yeah, I mean,
That seems more for the townwide one that we were talking about would be more relevant with, those numbers should be significantly less
significantly
for
smaller.
one department.
Yes. So that's what
Okay.
we're looking for overall. Yes. Town
All right.
town employees. But again, it's your office and what you're looking at, but much better than I.
Okay.
And-
Gene, just out of curiosity, how many town employees do we actually have? Do you know any even a ballpark?
So I photographed a lot of them. So I'm going to say, but Jean would probably know better, 250, 300.
Well, it depends. If you want to talk about town only or town and school,
Oh, very true.
it depends how you want to qualify it.
Okay. I think what we need to determine is how we want to qualify it as either this is department oriented or this is town oriented. And I think that's a big distinction, right?
Another way you could look at it and reword it if you wanted to is demographic of you've worked on towns with 26,000 residents. I mean, that might be another way to qualify it. So they've looked at health departments that are servicing highly advantageous would be 30,000. Advantageous would be 25,000. And so, you know what I mean?
That's a great idea.
You could do it, might be able to qualify it better that way.
Do you care about this criteria? Is this?
No. Sorry, I don't. But I don't know if others do. What do others think?
Public health is public health, isn't it?
I mean,
Yeah, so we don't want to have governmental clients in there.
and they will, I mean, so the thing that worries me, I like population, but the thing that concerns me about it is, again, not sure how many departments have, how wide the sample is. So like Plymouth, I don't think they're comparable in population to us, but if somebody that did the Plymouth job bid on it, I think we would be interested in it. So I don't want to exclude somebody.
And then there was that regional study that was done with Chelsea and Revere, and you wouldn't want to not allow that consultant team. I don't know if it's the right team, but you wouldn't want to exclude them or really mark them down because it's not the same size community.
Right.
I mean, what's the benefit of it?
Well, the only argument I would say to the benefit of it is we're asking this consultant to determine the best way for the health department to function. Part of that would be, to me at least anyways, part of what they would have to look at is what they have to deal with on a day in and day out basis. Your number of town employees would come into play with that. Your number of residents would come into play with that thought process. But maybe you don't want to have it as you said, as something that will exclude you from being in that. Maybe we can put that and make that evidence somewhere else in the document that says part of the role and responsibility we would assign to will be to properly assess not only the department, but how the department works with town and residents across the board. I just want to make sure both are looked at.
Yep, because we do ask that part of the work is identifying comparables for us. That's described in the. So Allison, are we Are these measures supposed to match to the deliverables or the elements of the final report? Is there a way that are these like evaluation components that could match up, or?
No, it's probably because you have a group of people who will be determining who will be the proposal to move forward. It's just having the criteria, as Jean said, it will make it much easier for you all to say, okay, yep, this one is highly advantageous. We've set that as something that's important to us,
yep.
Or it's just, it helps a group to all look at the document at the same time. It can be very hard to read through a proposal. You all might get a different sense from it. But if the size of the town doesn't matter, or the staff at the town hall doesn't matter, you certainly don't have to have that criteria in there.
I feel like their experience and their ability to do comparables is more valuable than necessarily having done exactly a town of exactly the same size, or
Yeah, seeing it right there, Carrie, I'm fine with that language, just as long as there's something that
yeah.
they're
Yeah,
going to
so
provide.
I mean, yeah, that's why I was asking Allison if we would link it, right? Because they need to be able to provide comparables, comparative data with communities of similar size, and do we want to say similar size? Similar size. Okay.
I might actually even add in similar size and makeup, i.e. cities versus towns.
Yep. And makeup.
So, Allison, what would be the best way to word that if I'm trying to distinct between cities and towns? Should it be governmental makeup
I was just
or town government?
Yeah, everyone's gonna write me
Governments.
that question. What are you talking about?
Form of government.
Of government.
How's that?
Right.
That work, Allison?
Perfect.
Okay. Yes. Yeah, there we go. Okay. So then, do we need that criteria? Where are we? Project size experience.
We can probably remove that, right?
Yeah, let's remove it.
Okay. Methodology and time schedule. I didn't have anything on these. These qualitative ones were you know, I thought they were reasonable. Did others have any thoughts? Okay.
No, can you scroll up to 3 though? I thought I just caught something on the corner of my eye. Just want to double check it.
Bet you did.
Maybe not.
Eagle eye, Kev.
Yep. No? You all right?
The 5 on the unacceptable in parentheses.
You are okay. All right. Methodology and time schedule, that works. Quality of technical proposal, I didn't have any comments. I thought that was easy to work with. This includes a suggestion of a presentation of people before. I started to strike that, but that was my thought. I don't know if others would like to. I started to strike it from the perspective of I thought it might delay us, to be honest. But
It will definitely delay you. This is
Yep.
Allison. That doesn't mean you shouldn't do it, but it will
Exactly.
definitely add to your schedule.
exactly. Would people like to meet the people who would be doing this, or are they content to have the selection committee, which I think we agreed was going to be Rick and Jean or Rick and Bob or Rick and Jean and Allison? No, who's going to be our third?
I think it was Rick, Bob, myself,
Yep.
and Allison.
Okay.
I think that's what we decided.
Okay.
So in my experience, you don't have to put this in there, And then if you decide you do want to meet them for whatever reason, I think there's always that flexibility, right, Allison?
Absolutely. Yeah, you could take it out now, and then if you were struggling with the proposals that you got, or you wanted to get more information, you could ask them in. Yeah.
Good. Okay.
Okay.
And then I had no, my only question was on this contract we awarded within 20 days after the proposal opening. So proposals will all be opened and reviewed. And so that's a quick timeline turnaround for awarding. Is that
It does allow you to extend it up to 45 days though, in,
Yep.
in that next line.
Okay. So, I mean, I'd like to have it be quick, but just wanted to highlight that. Nobody looks like they have anything. I literally had nothing else on this. This is all procurement. I read it, but I didn't have any standard procurement language.
Yeah.
So
This is like all boilerplate.
oops, I lied. Yeah, it's boilerplate. 3 or more sample reports. Again, same thing. I don't know if that's achievable.
Again, wouldn't that delay us more?
No, this is
Is
When-
it standard?
it really depends on the project and what you're looking for, but this is so you can see what some of their work looks like.
Sure.
It's up to you if you want to see 1 sample report, 3, 5. But again, we have to bear in mind that you're trying to stay under $10,000, so you don't want to be asking for things that are going to really kill your budget as well. But this is just how many reports do you think you could get a feel for the quality of the work that this proposer may do?
I would say 2. I think seeing something that they've done is kind of important, because they can talk a good game.
Yeah.
But so maybe 2, and I think 5 references is perhaps a lot. Maybe
3,
maybe 3.
maybe?
Yeah, 3.
Yeah.
Perhaps.
I'm trying to move all your heads so that I can see my toolbar here. Oh boy. There we go. 3, and then this is project. So 3.
Yeah, and I thought we said 2 on the upper one, 2 sample reports and 3 references. Am I wrong? That's
No,
what I
you're
thought I
right.
heard.
Did I not type? Yeah, I didn't type
Yeah,
it.
2.
I just cleared it. I didn't type it. Thank you. And I 40. 2, 2, 2, 3, 3. Oof. There. Now I promise I didn't have any other markup. Did anybody else have other thoughts?
Yeah.
Nope.
All right. So, can we, so should we, so we'll send this to Allison and say that we approve this as marked up? And do we want one person to review it when the changes are when Allison makes it final? Or do we just defer?
I think,
The other question you have to answer is, when do you want me to send it out?
well, personally, this is Rick. I think Allison, if you just sent this to Allison, she can sort of accept the changes and make sure it's clean and so forth. I don't think there's going to be anything that we need to look at again. Again, this is a request for a proposal.
Yep.
And if I'm looking at my calendar and, Allison, I don't know how fast this could go out, but let's say it went out on
Tuesday.
Monday. Oh, actually, Monday's a holiday, isn't it? Well, if it went out on Tuesday and they had 3 weeks, that would bring it to the 20th, 27th, November 3rd. So theoretically, on November 3rd, we would have all the proposals in, and then it's going to take the selection committee, I would think, a week to read and convene and decide, but we're going to miss the November 5th board meeting.
Yep.
So that brings us, I guess, to November 19th to finalize it. And maybe that extra 10 days is some flex time in case proposals don't get in and there's a straggler and we have scheduling problems or whatever. So I think that's the time frame. So I would suggest, Allison, just get it out either tomorrow or Tuesday, and we tentatively plan for the November 19th meeting to hear the recommendations of the committee and hopefully approve.
So just to be clear, we have town meeting that starts November 9th. And we always block off 4 nights. I don't think it's going to be 4 nights, but the 19th would be night 4. But I don't think that's going to be an issue.
Okay.
We should, if it goes 4 nights, I'd be very surprised.
So will the selection committee with you and Jean, you and Bob, will that be a problem for you guys to convene in the time period between the 5th and?
What's problematic is we have a holiday in there, Veterans Day. It gets tricky, but I can't imagine that this would be a very involved thing. I really can't.
I agree.
I mean, I know, town meeting is, subsequent town meeting, there are not a lot of articles.
Mhm.
So
Okay.
I'm going to take a guess that it'll go 2 nights and it would be over, the week of the 9th is tough because it's town meeting on the 9th,
Yep.
Veterans Day on the 11th, and then town meeting on the 12th.
Yep.
That week's a little thin. But the following week, we should be cleared. Bob does have a select board meeting on the 17th, but I would think in 1 meeting we could get this done.
I would think so.
I would
Read the proposals in advance and then
Yeah.
discuss.
I don't think this is a big involved thing.
So
Oh, I
selection committee would have to meet the week of the 16th.
Mm-hmm. It may be possible to meet the previous week. It may be possible. Yeah. I mean, we could even schedule that now and just block the time.
Okay. All right.
Okay. So that sounds like a plan.
So if you chose a proposal by November 13th, do you believe the vendor would be able to give you a report by January 31st?
That's exactly where I was thinking.
That's a tight timeline myself.
And if you could go, Carrie, to the first page of this, we can add the date that we want it to be due. I'm sorry. So, yep, that's the cover. I think it's in yellow on the first or second page.
Yep.
and then you can all discuss your due date of January.
Okay,
So right
so,
here.
so we want them submitted by November 5th. Is that what we said? Yes. 2020. Okay. And then, so do we advance it by a month to February 28th?
That sounds reasonable to me.
And if the time, so if that timeline is unreasonable and unachievable, the vendor can tell us that.
Right, right.
So, okay. Right. I think we're almost done with this puppy.
So if someone wants to send me the list of vendors, and I'm happy to accept all the changes and send it out for you tomorrow.
Okay.
But if you tell me who you want it to go to, or I can wait till Tuesday, that's not a problem as well. Whatever works for you all.
Okay. Jean and I, we have that list. I shared it with everyone. And I know
Maybe sending it out on a Tuesday, going to be more in front of people's, front of their minds, so to speak, as
Yeah.
opposed to going in on Friday on a long weekend.
right. Okay. Where is that? There it is, February 28th. Okay. All right, so we're gonna I'll send this to Allison now. Get you the list of vendors. And it will go out, I think Tuesday is reasonable because I think that's fine. If I can pull everything tonight, we don't go too much later, then
February 28th,
yes. I just changed it from January 31 to 2/28.
that's a Sunday.
Can't win.
2/6.
March 1st, that's the Monday.
I could do that.
Yeah, that's good.
Alrighty. This is not the
2021.
nice. Getting some of the eagle eye stuff that Kevin does.
That was a good pickup, Gene, man.
Yeah, I missed it entirely.
Kevin, you're an inspiration.
Okay. All right then. So send this to Allison and be done with it.
Should we vote on it, or should you vote on it, I should say?
Ha. Oh, okay, so would anybody like to make a motion?
That was a legit question. I wasn't suggesting you do it.
I don't know. Do we vote on it? I'm happy to do a vote if that is tidy, but anybody want to make a motion to accept this document as marked up for submission by the procurement person to
So moved.
nope, somebody's got to second me.
All right, I'll second you.
Roll call. Carrie, yes.
Paula, yes.
Rick, yes.
Okay. All right. So that's done. I'm stopping sharing that. Woo. Thank you, Allison.
Thank you very much.
Thanks, guys. It's been great. So if any of you have any questions, shoot me an email, but that will be the plan. Have a great long weekend, everyone.
Thanks,
Thank
Allison.
you. You as well. Thanks.
Thank you.
Okay. So then our remaining items are upcoming meeting schedule and agenda items. Supplemental public health services needed. We were going to do a brainstorm, and then Halloween. if I may, I'll take out of order and tell you with Halloween that I and Laura's been part of it, worked with Jane Wellman, and she was working on making a piece for us that would be suitable for posting on the website, distributing by email, used on social media, shared with the schools and the like. It's based on the CDC guidelines, and she just, I don't think, got a chance to finish it today. So when I receive it from her, or I guess, I don't know if she'll send it back to me or if she'll send it to the board. I'll bounce that through, but it was very clear. It's right tracking to the CDC guidelines, pretty simple. We were trying to make it sort of in a directive voice of, do have small groups for trick or treating, do use face coverings, and so
Right.
forth.
Okay.
Okay.
Okay, good.
So, Laura, did you want to add anything about Halloween? Thank you for finding that link.
Nope, no, yeah, that's just that link I really liked, and that's about it. People are calling in droves about
Yes.
it, so.
It's wise if we can include a link because people have more questions. So sending them off someplace to get more informed is good. Thank you. Okay.
Yeah, the good part I've seen out there, the chatter seems to be, people are very aware of what's going on, and I've heard a lot of talk about laying tables on their front lawn with little baggies of 3 pieces of candy, strewn about all over them, and kids can just walk up and grab them. So from what I'm hearing out there, people are very conscious about, the face-to-face contact aspect of it, which is great.
Yes. Yeah, I've heard similar things. Somebody was talking about skewers. They're going to put skewers and stick the candy bars on those.
Maybe not that one.
maybe not a skewer, but yeah, the small groups piece, just wanting people to be safe. It's the same thing, sort of using your common sense and protecting your bubble. So, okay. All right. So, meeting agenda and our brainstorm on supplemental services needed.
So we have nothing on the agenda as of right now for next Thursday. My question would be, do we want to have that meeting or not? Do we anticipate something?
So there is an agenda. Sorry, I created it and then let me tell you what was on there. So
I only bring it up because this was going to be a 5-minute meeting originally, but
I
we've done this before in the past, way back when, and said only for minutes, and then we were there for 3 hours.
I know. And I don't know why my draft isn't where it's supposed to be. So now I have to go to my email. So one of the things that was on there was, classic agenda. I did this back in September. $15. Here it is. I promise I'm coming. Open. I want it open. Here it is. I'm coming. I promise. See, we were ready to post it. And the only thing that was on there was if we wanted to talk about reorganization. So that was the question. It's a standard agenda otherwise, but we do have the open question. Oh, And the town manager asked to come see us.
Oh, okay.
And I thought Laura Gem was coming too.
I don't know that, but she's always welcome.
I thought I may be misremembering.
We did talk about that. I
Yeah.
can't remember if Laura Gem said in command that she was all set.
Yeah, I mean, the way we talked about it in command, she was going to make the modifications to the what I would call is she was going to make the modifications to the plans and send them back. And I think she was all set with command, but does the board want Laura to come back and review what the election day plans are going to look like?
I would think-
I'd like to see it.
Yeah, you could always just put elections on there and then
Okay.
Bob may be able to talk to it or,
Yep.
It's probably not a bad idea to put it on.
Okay. Right, and this was the reason why I didn't, I had asked Laura to hold off because I had included reorganization on here and it on my version and it dropped off when it was transferred into the template. So, so we've got reorganization. We've got the town manager who wanted to come talk to us. He wanted to talk to us about some questions about opening town buildings and sort of how things are going currently. Yes. So, given that, there will be no command meeting to review. There's not a command meeting scheduled for the holiday, unless something changes. We'll be done with the public health needs assessment. That can come off. So given that, we need a meeting with the town manager. He wants to come see us. Then we could defer the discussion about supplemental services to that meeting if you want, if we want him to be part of that, if people are.
Actually might be a good idea.
Yeah, it sounds like a good idea.
I agree.
Okay. Okay. So our agenda for next week will be the town manager, a discussion of the supplemental services needs. We won't do the public health needs assessment. We'll certainly we'll talk about COVID because we always do. And then there's the question of reorganization. Okay. We ready for that to be on the board, on the agenda? Okay.
Sounds good.
Yep.
All right. So we'll suspend that item of supplemental services, and we've already talked about our meeting schedule for next week. I'm going to modify this agenda, send it to Laura so that it'll be ready to be posted. And I don't think yeah. What do you have, Rick?
Nothing. I have a motion to adjourn, but
Second. I like it. Roll call. Carrie, yes.
Paula, yes.
Rick, yes.
Thank you all for being so patient watching paint dry. Much appreciated.
Thank
Yeah,
you.
thank you, everybody.
Bye.
Night.